For years, Jamaica has been operating at just about 50% of the blood donations needed to meet national demand. That means for every 2 persons who require blood, only 1 donation is available. And the truth is, many of us only think about donating when there's a tragedy. But hospitals need blood every single day. With a single donation, you can make a big difference. You are somebody's type.
Donating blood is easier than most people think. Once you are 16 years or older, with parental consent at 16, you can donate. 17 to 60, just walk in and register. Up to 65 if you're a regular donor. You will need to present a government-issued ID. If you weigh at least 110 pounds and you're in good health, you're likely eligible. Controlled high blood pressure? That's okay. Diabetic but not on insulin? That's okay too. Tattoos or piercings older than 6 months? You can donate. We do a quick check of your hemoglobin level. If it's 12.5 or above, you're good to go. You will also have a short conversation with one of our medical professionals just to ensure that donation is safe for you. The actual donation takes about 8 to 15 minutes. That's less time than taking a lunch break. Less time than scrolling your phone. Your body replaces the volume within 24 hours. Red blood cells take about 6 weeks. That's why you can donate every 3 months. We will help you to rehydrate before you leave. Just remember, eat before you come and drink plenty of fluids. Every donation can help up to 3 persons. They may never know your name, but they will live because you showed up. Because somewhere today, you are somebody's type.
When we give a little, we make a big difference. A mother after childbirth, a child with sickle cell disease, a patient undergoing surgery. Right now, donations are at 40 to 50% of what's needed, which means there is room for more of us. It's simple, it's safe, it doesn't take long. If you're able, consider giving. We'll be here to welcome you.
Good morning, ladies and gentlemen. Please stand for the national anthem. Standing while I invite Reverend Harris to say prayers.
Let us pray. Almighty and everlasting God, this is the day you have made, and we will rejoice in it. We rejoice because we are alive, and you have brought us together today at this moment for a specific purpose. So we come with grateful hearts for the birth of CARE, the Community Arrange Response Effort. Thank you for this vision that you deposited in the hearts and minds of those who have used to make it a reality. Your word tells us in Galatians 6, verse 2, to bear one another's burdens and so fulfill the law of Christ. It is with that spirit that we place CARE before you as it seeks to uplift communities, strengthen partnerships, and bring hope where there is most needed. We thank you for every leader, organizer, volunteer, donor, and citizen who has committed their time, skills, and resources to this noble cause. Grant them wisdom, integrity, compassion, and courage as they serve others. Lord, even as we thank you for the human resources, we lift before you the financial resources, the CARE Grant Fund of $500 million. We pray that it will be managed with transparency, fairness, and accountability, reaching those who need support the most and creating lasting opportunities for growth, resilience, and transformation. Bless every project that will be funded, every family that will be benefited, and every community that will experience renewed hope because of this initiative. May this effort inspire unity, encourage collaboration, and demonstrate the power of people working together for the common good. Guide all decisions made today and in the days ahead. May this launch today be the beginning of meaningful change, bringing healing where there is hardship, opportunity where there is need, and light where there is uncertainty. We commit this event and the future of CARE into your hands, trusting that with your guidance, great things can be accomplished for the benefit of all. In your precious and holy name we pray. Amen and amen.
Can be seated. Thank you very much, Reverend Delroy Harris, Associate Minister at the Webster Memorial United Church. Dr. the Honorable Christopher Tufton, Minister of Health and Wellness. Mr. Errol Green, Permanent Secretary in the Ministry of Health and Wellness. Chief Technical Directors, Dr. Kimali Humphrey, Principal Director, Enabling Environment in Health and Client Services. Other members of the Ministry's Directorate, Dr. Karen Webster-Carr, Acting Chief Medical Officer. Mr. Elroy Gilmore, Registrar, Department of Cooperatives and Friendly Societies. Mrs. Jacqueline Allen, Registration and Development Manager. Executives and members of the NGOs and CBOs present, distinguished guests, ladies and gentlemen, members of the media, good morning. No, man, it's a big Monday, you know, it's a happy Monday morning, right? You can do better than that. Good morning.
Good morning.
Yes, my name is Stephen Davidson. I'm the Director of Public Relations and Communications at the Ministry of Health and Wellness, and I'll be guiding you through this launch of the Community Arranged Response Efforts Care Fund that the Minister would have announced during his 11th sectoral presentation. And we are here to officially launch the fund and for the call for proposal. So we're not only a ministry of movement, we're a ministry of action, right? Is that an amen? Amen. All right, we are ready to move. And today we're going to say it's Money Mondays, right? We have some money to give away. And when Jamaicans getting money, what them do? What happened first? Some hands scratch them. So all the community partners who are here, scratch in the hand middle. Because when they're going to get some money, if we get the sensation, okay, we can fake it till we make it, Shelley. But we are here to launch the Care Fund. So to give the official welcome, I want to invite the Principal Director for the Enabling Environment in Health and Client Services, who has responsibility for the Care Fund. Please welcome Dr. Kimali Humphrey.
Dr. the Honorable Christopher Tufton, Minister of Health and Wellness, Mr. Errol Green, Permanent Secretary in the Ministry of Health and Wellness, Acting Chief Medical Officer, Dr. Karen Webster Carr, members of the executive of the ministry, Mr. Errol Gallimore, Registrar of the Department of Cooperatives and Friendly Society, representative of partner agencies and collaborating institutions, distinguished guests, members of the media, ladies and gentlemen, a pleasant morning to you. It's my distinct honor and privilege to welcome you to the official launch of the Community Arranged Response Effort Fund, affectionately known as the Care Fund. Today marks more than the introduction of another program. It represents a deliberate investment in people, in communities, and possibilities. It reflects a shared commitment to create conditions in which every Jamaican can enjoy improved health, stronger support systems, and greater opportunity to thrive. Health extends beyond hospitals, clinics, medicines, and treatment. Health is shaped in our homes, our schools, our workplace, and our churches, and of course, in our communities. It is influenced by the environments we live in, the choices we make, the opportunities available to us, and the support systems around us. For this reason, meaningful and lasting improvements in health require more than institutional action. They require partnerships. They require innovation. They require communities that are empowered to identify challenges, mobilize resources, and lead solutions that respond to their realities. The Community Arranged Response Effort Fund is established with this understanding at its core. The Care Fund is designed to support initiatives that strengthen the health and well-being of Jamaicans by addressing the broader factors that influence health outcomes. Through targeted investments, the fund seeks to encourage prevention, promote healthier lifestyles, strengthen mental and physical wellness, support vulnerable populations, and build stronger and more resilient communities. Importantly, this initiative recognizes that some of the most transformative ideas do not always begin in the boardroom or policy spaces. Often they emerge from the lived experiences of citizens, community groups, civil society organizations, faith-based entities, and local leaders who understand their communities best. Today's launch, therefore, signals an invitation to organization to innovate, an invitation to communities to participate, an invitation to stakeholders to collaborate, and an invitation to all of us to think differently about how we deliver sustainable health and social outcomes. As we gather here this morning, we do so with confidence that strategic partnerships and community-led interventions can create measurable and lasting impact. We believe that healthier communities contribute to stronger families, greater social stability, increased productivity, and ultimately national development. I wish to acknowledge all those whose vision, dedication, technical expertise, and collaborative effort have contributed to bringing this initiative to this important milestone. Your commitment reflects a collaborative determination to move from aspiration to action. To our prospective applicants and partners, I encourage you to see this fund not simply as financial support, but as an opportunity to create practical, sociable, and people-centered solutions that improve lives and strengthen communities across Jamaica. Ladies and gentlemen, today we launch more than a fund. We launch an opportunity. We launch a platform for collaboration. We launch a commitment to healthier and more resilient communities. As we launch renewed hope and meaningful change, this can happen when institutions and communities work together. Thank you for being here and for sharing in this important occasion. Thank you, and may this launch be productive, inspiring, and impactful. Thank you.
Thank you, Dr. Humphrey. And you must follow the money, right? When you can't find minister, we'll find Dr. Humphrey. He has the money. All right, so we know that in public health, our priorities and our programs are anchored in partnership. And so we're pleased to have the support of the Department of Cooperatives and Friendly Societies. So at this time, I invite the registrar, Mr. Errol Gallimore, to bring his greetings. Please make him welcome.
Thank you very much, Mr. Master of Ceremony, Dr. the Honorable Christopher Thompson, the Permanent Secretary, Dr. Kimali, Reverend Harris, and other distinguished guests, representative of all the community-based and non-governmental organizations. Ladies and gentlemen, good morning.
Good morning.
It is indeed a pleasure to join you today to extend greetings on behalf of the Department of Cooperatives and Friendly Societies, better known as the DCFS. I commend the Ministry of Health and Wellness on the launch of the Community Arranged Response Effort Fund, an initiative that recognizes the indispensable role community organizations play in advancing health, wellness, and social development across Jamaica. At the department, we work closely with charities, community-based organizations, friendly societies, and other nonprofit entities that are deeply rooted in communities where they serve. We have witnessed firsthand the transformative impact these organizations have on the lives of individuals, families, when they are supported by strong governance, sound leadership, and sustainable resources. Community organizations are often the first to identify emerging social needs and the first to respond when challenges arise. They provide support to the vulnerable. They give voice to the marginalized, create opportunities for the youth, care for the elderly, strengthen families, and foster a sense of belonging and shared responsibility. Their work reaches beyond programs and projects. It touches lives, restores dignity, inspires hope, and empowers citizens to become active participants in shaping their own futures. Mr. Master of Ceremonies, permit me to share with you a few words of wisdom found on a wall in an orphanage in Calcutta, India. It goes like this: if you are kind, people may accuse you of being selfish and have ulterior motives. Be kind anyway. People, what you spend years building, someone could destroy it overnight. But build anyway. The good you do today, people will often forget tomorrow. But do good anyway. It is this initiative, like the Care Fund, that must do good anyway by being a success in its own initiative and objective, as it offers an important opportunity for those organizations to broaden their reach and deepen their impact by investing in community. We are investing in healthier family, safer neighborhood, stronger social network, more resilient communities. When community organizations succeed, the benefit extends far beyond the individual beneficiaries. It creates positive ripple effect that contribute nationally and social cohesion and economic progress. Ladies and gentlemen, strong communities are the foundation of a strong nation. Across Jamaica, community organizations serve as trusted partners in the development, helping to bridge gaps, mobilize volunteers, encourage civic engagement, and strengthen social fabric that bind us together. Their contribution to nation building cannot be overstated. They help to transform the challenges into opportunities and convert local action into lasting national impact. As a partner in this initiative, the department remains committed to supporting organizations in building the governance, compliance, accountability, and institutional capacity necessary to access opportunities such as these, but also to sustain their impact for generations to come. We recognize that when community organizations are strengthening, community flourish. When communities flourish, Jamaica prosper. The partnership reflects a shared understanding that meaningful and lasting change is achieved when government, civil society, private stakeholders, and community leaders work together towards a common vision of inclusiveness and sustainable development. As I close, I congratulate the Ministry of Health and Wellness on this significant milestone and reaffirm the department's commitment to support the success of the Care Fund and the organization that will benefit them. And so I have given instructions for a special window of registration to be so created to facilitate this particular fund. Normally, our registration period is usually around 50 to 55 days, and I've asked for that time to be reduced so as to enable these community groups that will come to fast-track their registration process. And that is how strong the department feel about this particular fund. So I close by wishing the fund all the success. Thank you so much. Good.
But wait, is how so much I want in here. Then is who let you know. I am the groundsman, the key man, and the whole I want to then and me never open up nothing. No man, this can't work. You wait till Peaches she reach. You just wait. I not do a thing until she reach. Not doing a thing. Oh, look at you, them take seat. Hey, I feel them place.
to me. Give it to me. We are doing sweet juice early in the morning, sir.
Me I go drink it.
Look here. You a soda too. You know saying I'm supposed to drink no soda. And all banana chips? No, man. Mr. Greg. How much time you must talk to you about the same thing, sir? You take a medication for morning? You metformin?
Me have to eat before me take the meds.
Not banana chips and soda. Mr. Greg.
Yes.
You go drink water today, you hear?
Morning, nurse. Uncle. Morning.
Kevin, tell me something. Oh, you have your uncle in the yard drink banana chips. He might eat banana chips.
Yes, his last night him carry it in for me. That mean me entitled to drink it and eat my banana chips. So just give me the things then, please.
You know me know better. It's must when him a come down here, him stop at the shop and buy it. Don't tell lie for me, uncle.
Mr. Greg, me now talk to you one more time because if you keep on doing this, you're going to end up in the grave.
Well, I'm my own big man. I do what I want to do. And the two of you can't tell me what to do. I'm my own big man.
Tired to talk to you. Me now talk to you again. Speaking of which, you go down to you to apply for the thing, yes?
I go down there, auntie, but I don't have no money for apply.
Kevin, how much time I must tell you the same thing? Go to the Ministry of Health and Wellness website and go apply for the scholarship. No nursing you say you want to do.
Nurse who?
Nurse you. Uncle, you know, see the thing, you know, auntie help me to do a lot over the community center, you know. She teach me how to check vitals of the elderly. She teach me how to do blood pressure test. And she'll teach me how to distribute the pill them properly amongst everybody. So, she'll do a whole heap in the community center.
And it might help me do whole heap too, and they're doing a good job.
Yeah.
Yeah, me I hear one about that. That just not work. It not work.
Excuse me?
Well, on there, it's 25 years me that this a center, you know. And from me that this a center, you the worst.
Mr. Greg,
what you mean?
See it?
Mr. Greg, what do you mean by that, sir?
Yeah.
If you don't know me, medicine soon run out. That a one. Two, me have to turn janitor, me a key man, me a everything me a do because we don't have enough money to fund nobody no want work, so them left and go find new opportunities. And to think about it too. Every time the pregnant mother them forward on Tuesday, I don't know what to tell them because I could win lost. Clinic keep. And oh yes, and the health fear. When lost, we have a health fear.
Mr. Greg,
oh God.
Mr. Greg, you know, that's why we are of the big function today. That's why we are keep it. So you see the whole of them important people that will come in. Listen, the government, the Ministry of Health and Wellness, them have one new initiative when named CARE Fund.
CARE?
Yes, the CARE stands for Community Arranged Response Efforts. And it's a fund where can help people like we community center, church groups, non-government organizations. Yeah, our civil rights group, them can apply for the CARE Fund to help them people. So listen, Mr. Greg. You see the pregnant woman them when you talk about? Them going to be able to come in and actually have clinic because the prescription what we need to give them are going to there. We're going to afford it. We can restock, Mr. Greg. Listen, you see all the people that walk out of the work with no money?
Yes.
We're going to start pay them so you can stop do so much things. Yeah. Mr. Greg, last thing too. We can help the elderly, fill them prescription. We can even help people with non-communicable diseases like you, diabetes, hypertension, and banana chips.
So nurse, them care about me too?
Yes, Kevin, them care about you too. You remember our homework program?
Yeah.
We can start do that again.
That me a talk about man long time.
Me not like how that sound. That sound fishy. That can't work.
Uncle, it's a negative.
Oh, no, I don't think them can care for all of we.
Mr. Greg, you know, listen to what me I say. Listen now. Mr. Greg, between me and you, we take time talking. I think about 500 million.
500 million?
Hey, you know what banana chips and soda me can buy.
Hey, you see the vision now. The Franklin Community Outreach Center I got better with these funds.
Yeah,
Right, imagine, we can start a gym program. So we have the elderly exercise over here, and we have the young people them do a fitness competition, and we can start an annual healthy fitness competition and do the healthy eating too. The healthy diet too.
Yeah. And to top it off, all we need to do is just add a little concession. And right there, so we have whole heap of soda and banana chips.
No, uncle. See the better get a picture of uncle is warm to you.
All right. We can do diet soda.
Uncle, just see the bigger picture, no man. You now see the bigger picture.
Jesus. Me a look, but it kind of blurry.
Well on. Not the minister that a come.
Which part him name?
Look. No him that right there, sir.
Hey. I saw him did brown. No, man. Him hazy at work, man.
Yes, uncle.
You're the minister of it true. I don't have me out here stand up and talk about
Take time.
Look here, me have to listen. So me can't listen up. Me have to go listen so them can hear. How me can apply for the fund for the Franklin Community Culture Center too?
All right.
Yes, me excited about this. The Care Fund are going to make the community center better because them help you, them help me, and them help all the way. Hey, you know what on there? The minister talk, how many need to hear what I talk about?
This group look like they need a wellness bench, don't you think? All right, thank you very much for that dramatic presentation. I think the points were made, the key points. Let me just begin by just welcoming all who are here. There are too many to mention. Glad to see a full room of representatives of different community-based groups, faith-based organizations, persons, I would imagine, by virtue of being engaged in these respective organizations, have a passion and a commitment for pursuing a particular cause, and a cause that is intended to make society a better place. So whether it is, period poverty, or it is anything, whatever it is. Let me not single out. I want to start by recognizing, of course, the specially invited guests who are here. Thank you very much, Mr. Gallimore, Registrar of the Department of Cooperative and Friendly Societies. I'm patron of a charity, and I know the challenges of ensuring registration. And we try to make sure that our registration is in good order because it's very important. And anybody who knows the laws around friendly societies and how charities are maintained, it's not an easy task, and with good reason. And so to get this concession and this partnership, I really want to just express our appreciation. We're not asking you to ease up on the requirements in terms of transparency and accountability, but just to get the designation is very, very important. Dr. Humphreys, thank you very much, you and your team, for putting this together. And Rev, thank you for your blessings. Always appreciated. Other members of the team at the Ministry of Health and Wellness, Permanent Secretary hiding in the back there, Mr. Errol Green, and others, thank you very much. So let me give you a little context. This is a continuation of what I spoke to in my sectorial about a month or so ago, approximately. The CARE Fund, the Community Arranged Response Effort Fund. It's not a slush fund. Let me just be very clear. And I don't want us to approach it or think about it as money just to give away. It is money is provided by the taxpayers of Jamaica, budgeted for in the normal course of budgeting, designed to achieve a particular objective. And anybody who understands and appreciates how government works, particularly in these times, will know that the Auditor General is only about a few steps away in terms of ensuring that whomever benefits from these funds have to give an account, and that the objectives that are set have to be met, and that the paper trail to support it have to be in place, which is why the friendly societies are here, which is why Dr. Humphrey I don't want to say job is on the line because that might be a little extreme. But he has responsibility to ensure that from an accounting and transparency perspective, he manages that process. Ultimately, the chief operating officer, the chief accounting officer, the permanent secretary. So having passed that and made that very clear, and I'm sure you're all aware that that is very, very clear, because we have to maintain the reputation of the program, and to the extent that it works, it will work for good, and it can be continued and expanded. The fundamentals of why we needed to do this goes back to the core of society and how society functions. And the recognition that we have and are losing our traditional values and approach to how we build better communities and build better societies. If you cast your mind to that little diagram there that I sketched some months ago and properly refined by the creative people, you will see, and this is my own interpretation, but I believe endorsed by the ministry, that society really starts with people, obviously, and in the core of that is the family, right? I mean, that's how Adam and Eve came about, if you are going to read the biblical scriptures, and if you don't, you still have to come right back to people, whether you like it or not, right? And that collectively constitutes community, an environment where we all exist, where we interact, and we can interact in various ways. We interact at the social settings, at the bars, in the churches, the community centers, at the fairs, at the football game, and we can interact harmoniously, or we interact competitively, or we interact through conflict. And the results of that is a function of those interactions. And of course, the collection of community creates the society that we live in. Within that, though, there are influences that are going to bear heavily on how we behave, depending on what we buy into and depending on how we are guided, particularly the most vulnerable in the society. Now, a lot of people may question, how does that relate to health? Because, and one of the things I'm hoping to come out of this is that there is a redefinition of what represents health and wellness. Because we tend to, and with some justification, are critical of hospitals and health centers, doctors and nurses, operating theaters, long waits, as the end result of what healthcare represents, and not sometimes focus sufficiently on the primary goal of trying to enhance quality of life as a core, longevity of life for those who want to go to the longest possible living, and in countries around the world where quality of life and longevity of life are very much linked. And the influences that drive quality of life and longevity of life. And those issues are addressed even before you get to health centers and hospitals and nurses and doctors. Even before that. It starts with relationships. It starts with how people interact. It starts with, maternal care. It starts with just creating an environment that where we work together, as they say, being our brother's keepers, and supporting each other in a way that nudges persons towards a state of mind that see them vesting their interests and activities in the preservation of all concern for the betterment of all concern. It's an idealism that society oftentimes doesn't promote. Because we promote competition, we promote the strong surviving and the strong getting the best reward and so on. This care fund is intended to try to reset the the approach to what health and wellness represents in our society as a country. Because there's a recognition that we have lost, to a large extent, the fundamentals of what community and a sense of community represents. We have the infrastructure. We have 325 health centers across the country. We have 24 hospitals. We have 24,000 healthcare workers. We serve 3 million visits a year. We give 3 million prescriptions to people who are sick. And it's a moving target because of lifestyle issues, it gets worse every year, the demands on the system. You know, if you eat the worst food, you're going to get hypertension, diabetes, arthritis, cardiovascular disease. It's inevitable. If you consume alcohol, if you don't take care of yourself through exercise and rest, the consequences are there. And people expect the system to respond, even though, to a large extent, their conditions are self-inflicted. And so one of the things we're trying to do with this CARE fund and CARE program is to reset by creating an appreciation, again, for what society represents, what community represents, what family represents, and hopefully getting Jamaicans through community-based organizations to champion causes that promote more health-seeking behavior. You know, and that's really what it is. That's really what it is. The good thing about it is that there's enough of us to champion these causes. There are enough of us who believe passionately, who have a commitment to supporting initiatives that ultimately leads to the greater good of society and community. But we're not organized sufficiently. And I think what CARE is trying to do is to enhance, organize, and provide some fuel to that effort. So that even though we may be pursuing a different agenda along the CARE agenda, and we listed 10 in our sectoral presentation, collectively, the theme is the same. And collectively, we are developing, in a sense, an army of community themes that are supporting what is the best interest of all concerned. So take the issue of social media. Okay, somebody mentioned that. And we're almost finished a national study on the impact of social media and the perceptions of social media on our population, particularly our young people. The studies are very clear that the distraction through overexposure and through the wrong exposure has a mental health challenges on our population and our young people. Today we saw where the UK announced restrictions in that population. Australia has done it, many other countries. We've read the information, secondary data. We're now doing primary data research. In another month or so, we'll release those studies, and we intend to engage a conversation at the community level. And if there are mothers or organizations who are of the view that this is a real issue that needs to be confronted, and that we must take the positive from social media exposure, the learning tool, but also try and get the negative out, then this CARE agenda is a good one for you, because the future of our young people are very important. It is our obligation to support them and to build them and to make them better individuals later on. The issue of hygiene, for example, and the inequalities around period poverty, that's another big issue. The data is very clear. I made a statement in the parliament on that. If there are organizations that support that and can join us to support that and to build on top of that a kind of development and responsible behavior and supporting our young ladies in this case to become responsible, well-developed adults, then that's part of the CARE agenda. We're looking after our young girls so they become productive, responsible men and women later on in life. The same could be said in the life stage approach around menopause and andropause same issue. Things that we once ignored that are a challenge. And those challenges start in the families, at home, in the communities, sometimes not even recognizing the symptoms, not even diagnosing the problem because we don't understand it. But having championed the cause and create understanding, we create a better sense of community and how we live with each other. The issue of aging and the fact that our population is aging and how we look after those in the final period of their lives. It's a real issue. A lot of persons over 60, 65, they have chronic illnesses. They don't want to live with their children or perhaps have none to live with. They want basic support. Loneliness has become the biggest disease. They have no one to interact with, interface with. The system and the community must respond to that as another example. And we mentioned this concept of unpaid caregivers, 100 to 150,000 Jamaicans, I'm told, who every day, whether they're a church brother, church sister, or a cousin or an aunt, look after somebody in a home, cook their meals, comb their hair, wash their dishes, help them out, because they otherwise would have nobody. And they do it without pay and without recognition. As a society, I think we have an obligation to give them support and to help them because they are a critical fabric of the society. So this care agenda is not just logical or driven by policy. It is emotional, but it's part of the fabric of our society that we need to restore. Now, the impact of that on having a more caring society and a society that supports each other is a healthier society. It is. It addresses issues of domestic disputes and violence if you can solve your problem without fighting and quarreling. It shows better understanding when people are experiencing issues, whether it is menopause or otherwise. It defines the spirit of voluntarism, which oftentimes becomes absent in the sense of community where you can help each other, as some of us have to do. And I believe it promotes a sense of purpose and a sense of belonging, critical themes that enhances the quality of any society. And there are examples of that all over. As a society, we have become very harsh, we have become very selfish, and we have ignored some of the fundamental principles of how we help and support each other. And health care is a very emotional space, and we have a lot of work to do to be totally frank with you. So today's fund is to embrace partnerships, identify agencies, organizations that are willing to be a part of this initiative. Underpinning all of this is supporting health and wellness, both at the mental level as well as the physical, emotional, psychological, and doing so in a way that promotes an example that hopefully others will follow. So we're really creating a fraternity of people and organizations who are in it to do good. And we are saying we will support you through some sort of financial arrangements. There is a process that is involved in that, which Dr. Humphreys will, I believe, when the launch is, I think you're going up on the website today, right? The information, which you have to comply with. It's not automatic. It has to be followed. And there is accountability, as I said, that is necessary. I would love to see us be brave, bold, and out there exposing what we're doing, because I do believe that the demonstration effect is important. Yes, them say me is a PR man. I have no problem with that. If people don't know what you do, they don't know what you're doing, nothing or not, right? So if you have initiatives that are doing well and you can share those ideas, we would like a mechanism for those ideas to be shared When you get good results, share them. When you have to recalibrate, share your experience. So I'd like this group in and of itself and others who come on board to represent that community of doing well and trying to do well at least. And hopefully it becomes contagious and spread across the length and breadth of Jamaica. In a sense, it's probably can be seen, these social determinants of health and the focus around family and community as a kind of an experiment to explore the reinforcement of positive behavior within the society from a health perspective. There are organizations that do this every day, faith-based organizations and others that are engaged in good, going out there every day. But from a public health perspective, we think that it is necessary based on where we are in our development and where we need to go, because we do not see the solution to healthcare as building more hospitals and health centers. You cannot cure the problem. You have to prevent some of the problem. You have to cauterize it. And too often, the criticisms we attract is all about, can we add another 100 beds or another 100 doctors? And I'm telling you, and I have no fear or favor of being contradicted here, building more hospitals and health centers may be necessary because we haven't built a lot of them in many years. But that is not going to prevent, if you can't discourage the youth from drinking the energy drink and the white rum and going on the bike without a helmet and taking 2 Cialis while I'm doing it, as one man tell me in in Westmoreland, and ending up in a wall and spending a month in the A&E at Sab Hospital, then the problem won't solve. It just won't solve. And anybody come in this position will be frustrated. I'm not saying that we mustn't try harder, because I think the customer service level need to be improved, and our own people need to demonstrate a sense of empathy and need to demonstrate and encourage better harmony among each other. If we do not screen for early detection, cancer is one of the fastest growing rates of illnesses now. If we do not encourage our men to go to the doctor to get checked rather than when they're sick, and by that time the horse gone through the gate, for example, if we do not take those positions and be more activists for a good cause, then I dare say we're not going to solve the problem going forward. And so the Care Fund today is an attempt at just doing that. Getting like-minded people with varying interests, but with a common goal of community and family to band together and to support each other and to support these causes, and by extension to support government policy, which is why the resources become legitimate. So I thank you for this, and I look forward to identifying with you in your own initiatives to the extent that you become a part of the Care Fund and Care Program. I do intend to be on the road and to speak to and identify and visit and share in some of the moments that you are going to be pursuing. And we believe that over the next year, we can evaluate and determine how successful we are and tweak as necessary in order to continue to build this, ultimately from an experiment to mainstreaming and becoming a part of life, a better part of life. Thank you very much.
Welcome to the Care Fund web portal. The site is now live. You are invited to visit www.moh.gov.gm/carefund. We welcome your proposals for funding. On the web portal, you can view the various areas of focus for funding. You will be required to submit details about your organization, including name and contact information. We will also need to know about your authorized officers. Please include their names, titles, email addresses, and telephone numbers. In In the third section, you will be asked to provide details on your project. Please include start and end dates, the parish and community, and the target population. We will also need to know the budget for your project and the amount of funds being requested from the ministry. Feel free to share any additional source of income as well for this project. You will now need to supply us with your risk management plan and your plan for equity and sustainability. We also want to know the contribution of the entity and if there are any additional information or references that would be necessary, please include those. We also ask for your summer project work plan and budget. Once you've completed all those sections and attached any additional documents, please make your declaration of accuracy and integrity. You're now ready to submit your application. Thank you for participating in the CARE agenda.
All right, we are up and live. Give it up for the CARE Fund. We are ready to go. Dr. Humphrey, ready? Yes, so all you have to do is visit www.moh.gov.jm/carefund and apply. And money ready, right? Money is waiting for you. Money, all right? Thank you, Shelley. All right, another time for the CARE Fund, please. Thank you very much, Minister, for those words. And let me just big up our performers. Their performance was entitled Care to Share. The actors that you saw were Aisha Ritchie, Rashim Shepherd, and Orain Meikle, and directed by Kevin Sewell. So please give them a hand. All right, so we want to solidify our partnership with the Department of Cooperatives and Friendly Societies. I'm going to invite Minister and our registrar to the table here to just sign a MOU. I'm going to invite my PS to come and witness as well. PD, please join me here as we sign an agreement to formalize our arrangement with the department. I'm inviting also Mrs. Allen. You may stand behind them as well too. We have to get it in black and white, right? We love the commitment. And of course, the DCFS plays a critical role in the registration and oversight of many community-based organizations, faith-based organizations, and NGOs as well. Yes, go ahead. And they are here to support organizations in the registration, the governance, the compliance, and organizational readiness. Come to the side now, Pearson. Come in, join in. All right, another big hand for our partnership with the Department of Cooperatives and Friendly Societies. And of course, Minister is in a signing mood, so we want to see the money. We want to show us the money. So we want you to come and sign the check. You promised us 500 million, right? It's 500 million? Is that correct? All right, so come PD, come PS, we want to witness. We have to hold him to his word, right? Yes, sir. You don't want to sign the check. It's a mock presentation. It's a mock presentation. All right, let PS sign it then. It's a mock. They want me to sign it, right? They want me to come and sign it? Hold on. We want most of the money live, you know. We have to make sure. I have to hold them account. I have to hold them to account. All right. We could invite them with the check, Dr. Humphrey. So 1 or 2 representatives, just generally. Them afraid of money, man. And the 500 million they bought the place. Come here, Shelley. Any other rep? Rev come from our faith-based organization. Just on the stage here. It's what is available. Stand up here on the stage. Shelley. Yes. Minister, just join them as well. That's a tough time. Just join them as well, Minister. Join them in the picture. Dr. Humphrey. All right, quickly. All right. Thank you very much. So please give a big hand to our partners. Thank you very much. So let me remind you, one website you need to know, www.moh.gov.jm/carefund. And it's up and live, it's open, and we are ready for your application. So the deadline is Friday, July 31, 2026. And we also have sensitization sessions as well across the island that you can attend and learn more about. So we want to... We could do that afterwards, right? All right, so big up everybody. The minister has given me the wrap. So have a great day. God bless you. Take care. So all the NGOs, we invite you. We could do it over here. So all the NGOs,